Okay, we're going to continue with the axial skeleton and talk about the vertebral column. So vertebral column forms the vertical axis of the skeleton, runs from the skull all the way down to your pelvis. It supports the head and trunk and protects the spinal cord. Composed of bony vertebrae separated by a fibrocartilaginous IV disc, and vertebrae are connected by ligaments. Structure of a typical vertebrae. A typical vertebrae consists of a body, pedicles, laminae, spinous process, vertebral foramen, transverse processes, superior inferior articular processes, and the intervertebral foramina. So if you were to look at this, cervical, thoracic, lumbar, and sacrum. I mentioned this before, but you have 7 cervical, 12 thoracic, 5 lumbar, a fused sacrum, and a fused coccyx. I say fused because when in kids, these are 5 separate bones, and this could be 4 to 5 separate bones depending on the individual. But these fuse as an adult. Again, the way I remember it is I eat breakfast at 7, lunch at 12, dinner at 5, and snack around 1 and 1. Okay, so 7, 12, 5, 1, and 1 makes for a total of 7 plus 12 is what? 19. 19 plus 5, 24, 25, and 26 bones total in the vertebral column. The cervical vertebrae, again, there are 7. They support the head. Unique in that they have distinct transverse foramina in their transverse processes. They serve as passageways for blood vessels of the brain. The vertebrae 2 through 6 have a bifid, meaning that spinous process, that pointy thing on the back splits into 2, which no other vertebrae have. I don't know if you know Greek mythology. Remember the guy that holds the whole world on his shoulders and like this? He's known as Atlas. So we call C1 Atlas, which supports the head. Has 2 facets that articulate with the occipital condyle. So here's the skull, here's the 2 facets, and it allows for that. It has no body or spinous processes. The axis. The second vertebrae is the axis. So C1 sits on C2 and allows this twisting motion. So way that you can kind of visualize it is C1 allows you to nod yes or no, real slightly. Okay, and the axis will allow you to nod no this way. Okay, so no, yes, no, yes. So if a patient comes in and tells me they have pain when they barely look down, I could say, hey, maybe it's a skull on C1 issue. If they say, oh, they can barely move their head this way, oh, it might be a C2 issue. But if they say, hey, I can move my head, but at the very end, it hurts, then I know it could be lower cervical or thoracic because that's lower down. So it does give me some insight as to where to start looking. Remember, always listen to your patients because they'll tell you what's wrong with them. You just got to give them time to tell you exactly versus interrupting them and assuming that they have something wrong based on the diagnosis, right? Always listen to your patients. So here's the cervical vertebrae, here's the lamina, here's the body, here's the superior articular facet, here's the transverse foramen, transverse processes, so you can have blood vessels and nerves that can go through here, and of course your spinal cord will go through here. Here's that bifid meaning 2 process that goes through here, and that's only found in cervicals 2 through 6. Your thoracic vertebrae, you have 12. Remember, you eat breakfast at 7, which is 7 cervical, and I eat lunch at 12, which is 12 thoracic vertebrae. Articulate with the ribs, so you have 12 ribs on the right, 12 ribs on the left, so a total of 24 ribs. Features include a long pointed spinous process and facets on the side of the articular. So you'll have a body and the spinous process actually starts to point inferior. So you can, reminds me of a giraffe. So you can think of the thoracic vertebrae that look more like giraffes. Proceeding inferior, the bodies become larger and are able to bear more weight. So as you get further down, the thoracic vertebrae will get thicker, and then the lumbar vertebrae are your largest vertebrae. So here's a typical thoracic vertebrae. Here's the lamina. Here's that spinous process. Here's the superior articular facet. Here's the vertebral foramen. Again, the spinal cord will go through here. Here's the pedicle. You can get fractures here. Here's the body. And you can see compared to the cervical, it's getting thicker and thicker, and then the lumbar has the thickest bodies. Here's 5 lumbar vertebrae. Remember, you eat dinner at 5. They support the weight of the body, so you have L1, L2, L3, L4, and L5. You probably have seen that or heard that, hey, I have a disc injury at L4, L5, or I have a disc injury at L5, S1. So that's that little disc that's in between the 2 vertebrae. It's either protruding out and pushing on a nerve, which are herniated discs. They support the weight of the body. They are much larger and stronger than the cervical and thoracic, and they're adapted for weight bearing. So you can see the size of the body of the lumbar vertebrae. Again, when you go in lab, take a look at a cervical, a thoracic, and lumbar, mix it up, and maybe ask your lab partner, hey, is this thoracic, is this a lumbar, is this vertebrae? Remember, active learning. Instead of just looking at a bone and just staring at it for 3 hours with your lab partner or your lab instructor, be active and ask questions and make up exams, and that's the best way to learn the material. Okay, here's the pedicle, here's the vertebral foramen. You can see the vertebral foramen is a little bit smaller, but the spinal cord will still go through there. But there's less room for error here, and nerves can get caught. So this is where you heard of sciatica, where the sciatic nerve from L5S1 can go down the buttocks and all the way down the lower extremity and cause pain down there. Now remember, anytime they have radiating pain, it's usually nerve which is involved. The sacrum, the triangular structure of the base of the vertebral column, it consists of 5 fused vertebrae. Features include the ridge of the tubercles, posterior sacral foramen, sacral canal, sacral hiatus, and 4 pairs of anterior sacral foramina. Remember, in babies, this was not fused, so they're individual, but as an adult, they fuse. The coccyx, which is your tailbone, forms the lower part of the vertebral column and usually composed of 4 fused vertebrae. Some people have 5, but again, as an adult, they fuse together, so it's negligible whether they have 4 or 5. It's going to be fused into one. So here's the sacrum. These are all 1, 2, 3, 4, 5 that are fused together. Here is the coccyx. This kind of looks like a rattlesnake, right? A little rattle down here. So it's fused together. Okay, so the thoracic cage consists of ribs, 24, thoracic vertebrae, which is another 12, so 12 plus 12, 24, sternum, which is 1 more, 25. So the thoracic cage itself is 25 bones. Supports the pectoral girdle and upper limbs, protects the viscera in the thoracic and upper abdominal cavities, and plays a role in breathing. Okay. Normally humans have 12 pairs of ribs, makes it 24 ribs. Ribs attached to the thoracic vertebrae. Now, we divide these 12 ribs into true, false, or floating. So the first 7 ribs, 1 through 7, are called true ribs because they have a true attachment to the sternum. These connect to the sternum directly by their costal cartilages. The inferior 5 we consider those false ribs, so 1 through 7 are true, and then 8, 9, 10, 11, and 12 are false. A subset of the false ribs are 11 and 12 because they float. They have no attachment. Okay, so the upper 3 pairs join the cartilages at the 7th rib, so they kind of come together. So 8, 9, and 10, they fuse together, and then they join up to with the 7th rib, and that's why we call them false, because they don't have a true attachment. They kind of come and mesh together with the 7th rib. And ribs 11 and 12, they're floating because they have no cartilaginous attachment. Features of a typical rib include a curved shaft, a head, and a tubercle. The head articulates with the facet of the thoracic vertebrae, and the tubercle articulates with the transverse process. So the head will articulate in the back with the thoracic vertebrae. Then you have your sternum, which is your breastbone, located on the anterior midline of the thoracic cage. Its 3 portions are from the upper manubrium, the middle body, and the lower xiphoid process. So if you've taken CPR, you know where the xiphoid process is, right here. So here it is for the visual learners. If you look at this, okay, I have ribs 1, 2, 3, 4, 5, 6, and 7. They all have a true attachment to the sternum. each individual costal cartilage attachment. And like I mentioned before, ribs 8, 9, and 10, they come together, and then they attach via the 7th rib. So that's why we call 8, 9, and 10 false ribs. 11 and 12 are also truly false ribs because they don't have a direct attachment, but as a subcategory, we call those floating ribs right here. Okay, now again, so if you look at here, here's your heart, here's your lungs. So the thoracic rib cage is there to protect these vital organs. Your stomach is here, your liver is here, your kidneys are in the back. Now your right kidney is slightly lower, so it misses that whole protection than the left. So the right kidney is more susceptible to injuries because it starts dipping underneath that thoracic protection. Now some people, dumb as they may be, they start removing the 11th and 12th rib, and then just to get a different hourglass figure, but then they realize that you're losing the protection of these organs. Okay, so if you ever see people say, should I remove my 11th and 12th rib to get a better figure, just remember this lecture and say, no, dummy. You can say dummy because sometimes they don't know, but these ribs are there to protect your organs. So by removing this, you're not doing yourself any favors. But then again, there are some people that you can't help stupid. And I don't want to be brutal, but this is completely insane and stupid because she removed ribs 11th and 12th, so you can see that she has no protection in her vital organs, so everything gets pushed this way or pushed this way, and then on top of that she's wearing a corset, which is even really bad. Breathing can get affected, all this stuff. But so if a patient ever comes and asks you this, say no, no, no. Okay? All right. I think we'll end here with this.